Some people think a stroke affects the heart. Others think a stroke only happens to older people. Well, the fact is that a stroke can happen to anyone. And to put it simply, when a stroke attacks the brain, blood flow to it is suddenly interrupted, either by a blood clot that blocks a vessel in the brain, or a blood vessel in the brain bursts or leaks. And when it does happen, brain cells immediately start to die, up to 1.9 million brain cells every minute. So the faster it's treated, the better. Depending on which part of the brain a stroke attacks, its effects may be very different. It can affect speech, understanding and emotions, sensations and the ability to move parts of your body, or even paralysis, blurred vision or a blind spot in your field of vision. Even vital functions such as controlling your heart rate, swallowing and breathing can be affected. We represent the many facets of stroke and those it touches. Stroke is one of Australia's biggest killers and a leading cause of disability. The Stroke Foundation is here to change this by working to prevent, treat and beat stroke through research and innovative treatments, public awareness and support for stroke survivors.
According to medical science and research, it's 80% preventable. Some people are aware about it, and mostly people are not aware about it. What this thing is, we are going to talk about in our section on ACT Desi today. And to discuss that, I have a special guest, especially from the western part of Australia. And he will be talking to us about his experiences. And his name is, I will let him tell more about himself. Here you go.
My name is Avinash Swami. I originate from Fiji Island, of Indian background. I have been living in Australia for the past 35 years. I was an aircraft engineer. 2 years ago, I took early retirement. And currently, I'm working as a volunteer with some of the NGOs, and I am finishing my studies in mental health at a diploma level.
Right. So you actually taken an early retirement to start working again in a different section to help the society and community at large. Is that what it is, right?
Yes, because I mean, after seeing what a lot of the family members and the general community has been going through, and my interest has always been in later in life to help and work in the community. So apart from what I have been doing, I thought a good avenue would be to study mental health and see how I can help my friends and family.
Right. So thank you, Avinash, for that nice introduction. And as my listeners and viewers who are watching this are particularly curious about, I mean, obviously they can see the background that you have. It talks about stroke and it shows the brain. But let us just talk about something which is a little serious, an issue which people are probably not really aware about, and the reason why we are doing this. So as I said in the beginning of the show, it's about 80% preventable, and they just carry on with their life. So Avinash, just take me through, why are you there on this show with me today? What brings you to this show with me on ACT Desi, and what are we talking about today? How are you connected to this?
Okay. Approximately 4.5 years ago, my mother had a stroke. And that is how I became a volunteer with the Stroke Foundation. And after some training, I have been going around to the community, trying to increase the awareness of stroke. And in my mother's case, she has luckily made a very good recovery. The main thing was she had early treatment, and with the stroke patients, that is the number one most important thing, is to have treatment as early as possible And today my mother is 88 years old, living in Melbourne and doing quite well.
Usually we see that mostly the stroke happens at the later part of the life. That's basically statistics. But we're also seeing that there's a recent surge in people in younger age groups, as as young as adolescent, getting strokes. uh, what do you want to talk about that? I mean, is it like what I'm trying to arrive at, is it a disease which is only related to older generation, or is it like now getting more prevalent?
Stroke can affect any one of us at any time in our lifetime. As a general rule, it does affect people over 55 in men.
Hmm.
And for women, it's more in the 75 plus range.
Right.
But what is happening today in our community is more and more young people who are still in the workforce, like they're about 55 years old or under. There's 1 in 4 people getting stroke is under 55 years of age. And that is the most, sort of, the biggest worry for the community.
Do you think that people have ample understanding of what a stroke is? Do they understand what it means to have a stroke? Can they recognize generally? I mean, if you talk about 100%, if you say 100 people as a general rule, how many people, or how much is that percentage of people who would actually know this is a stroke? Is there like some kind of ballpark figure? I know for a fact that, I mean, I have heard about stroke, in my own general terms, but it was only recently that I was like became so much aware and conscious about this, because my own father had a stroke in June this year, and he suffered from stroke. But then I wanted to understand what is the percentage of people who know about stroke and its symptoms.
Unfortunately, the awareness in our community, especially with the migrant community, the awareness is not there to recognize what stroke is, some of the early signs of stroke, and the percentage is like less than 10% of our people are aware of what stroke symptoms are. And that is what, as a volunteer with the Stroke Foundation, we are trying to increase the awareness in the community, so we can pick up the signs and our people can avoid strokes as much as possible.
It's something, we understand, mishaps happens. People, meet with accidents, and, they recover from different kind of diseases that happens over a period of time in our life cycles. But what is that differentiating factor that you have seen in the case of stroke than to other illnesses that people have? I mean, generally, that is very differentiating, and that's very, what can I say? It's very alienating to other kind of disease. What has your experience been as a carer in a personal relationship to a person who's like very close relative, seeing that person suffer through?
We take it for granted a lot of times that we are going okay and nothing will happen to our health. Many diseases you do get a warning, like cancer or something similar. There is some warning that and gradually it gets worse. With the stroke, there is no warning. In my mother's case, she lives in Melbourne and I live in Western Australia. So she was fortunate that she went to a hospital and got treated within the 4 to 5 hours, which is very critical for a stroke patient. And physically, she has made a full recovery.
Sure.
But in her in the brain, there is some scarring. So the biggest symptom now she's suffering is anxiety. She's always worried about what is happening in the family, or if we don't have conversation on a regular basis, she will be quite worried what is going on.
Right. So do you remember the time when it happened, and the early couple of weeks or months, that time, what kind of situation was that, and what were you feeling, looking at your mother? Were there like severe symptoms? Were like, I mean, obviously their symptoms and what happens after the stroke are different for different people, depending on the severity of stroke and what kind of stroke the person has had. But in your case specifically, do you remember the early, say couple of weeks from stroke, and then the early recovery cycle of first 2 months?
The biggest indication for us was she was very confused. Some of the her behavior, like what she used to say, it could be taken as she's saying the wrong thing to you, but it was just confusion. She was also uh, probably quite upset with herself, not sure what she was saying, and it took the family some time to understand. And with my little bit of awareness of what stroke can do, trying to make my family members aware to give a bit more time as she settles down and gets some physio treatment, that she will slowly and recover.
Right.
And over the time, over 18 months, the first 18 months, she got better and better.
Right.
And today she's quite settled.
What I feel, having seen my father in those early weeks, and you know, in my experience, it's something that I feel that the person is, in case of an accident or in case of certain injury, you can see physically that there are certain injuries. If you have a heart attack, you have got a surgery done. If you got a break in your leg, there's a cast that will go off in 6 months or whatever time. So there's a timeline defined. But in case of a stroke, when a person has a stroke, they don't see any physical injury, per se, in your body. It's just like a internal injury, and you feel like your body looks fine, but some parts, like in case of my father, is the left side, and then his right side is completely paralyzed. And so he doesn't understand what's going on with him, because physically he looks fine, there's no injury, and then he can't suddenly move any part on the right side. So I think, what do you think, like, about that? That is that kind of an anxiety, or confusion of seeing your body as complete, but you still can't manage it, like which you used to manage like a day before, and suddenly it's not in your control.
Every organ is controlled by the brain, and unfortunately, when, like in your case, your father has just had a stroke, so depending on the part of the brain that has been affected, that bodily function has been lost or degraded. And that is where the person themselves is very confused. Something that they were able to do yesterday, today they cannot do. And for the family members to get adjusted to it and to learn a bit more awareness, because the brain is what controls every single thing we do.
Right. So I read in the Stroke Foundation's, on the website, and the presentation or whatever I've been watching on social media, that 80% of the strokes are preventable. And so my question to you is, can stroke be prevented, and how?
Okay. It is very true that 80% of strokes is preventable. So we'll talk about the 20% that is unavoidable. The 20% comprises of age. As we age, our risk of stroke increases. The other factors are our genetics. People of our background with the Asian, Southeast Asian background, people with darker complexion, we have a higher risk of stroke in the community. If we have a family history of stroke, our risk increases. The other thing is any existing medical condition. Two of the main things are the diabetic and irregular heartbeat. These things contribute to stroke as well. So the 80%, which is very good news, that the stroke can be avoided by making very simple lifestyle changes in our day-to-day life. And I'll expand on that. So the first thing is to stay on top of our health, have regular health checkups if you have an existing medical condition. So you take proper medication and your health is under control. We live in Australia. A lot of us have migrated from all around the world. Even in the middle of winter, we've had access to fresh fruits, vegetables, and by eating fresh, we reduce salt intake. Salt is another major cause of high blood pressure, and high blood pressure causes stroke as a result. So by eating fresh, we minimize our risk. Having regular exercise, we do not have to be a gym member. As we age, I mean, all we need to is go for 15, 20 minutes of walk, 3-4 times a week, with your friends or with your spouse, or take your dog for a walk. If you love dancing, join a dancing class. That's also, it's fun, and you're exercising at the same time. Singing is good. It's relaxing. Yoga, meditation, all those things are very good. If we do enjoy a few drinks in the evening, by drinking in moderation, have 1 or 2 drinks with your food. Try to give your body some rest. At least twice a week, avoid having alcohol. And drinking in moderation is it's fine. The other major cause of stroke is smoking. Smoking causes the arteries to clog up and increases the blood pressure. So if you do smoke, please consult your doctors or ring the smoking quit line. By reducing your smoking, we will reduce our blood pressure and reduce our risk of stroke. Yeah, so these are some of the simple steps we can take.
So I just take these two, people take out what they feel is interesting and what they want to carry forward with. So my outcomes for this, whatever you just said, is one is that it's most time the health choices that we makes a lot of difference. But isn't it same with all the things, and the doctors and generally, or also we say that maintain a healthy lifestyle, go for a walk, cut down on salt and sugars, keep checking your blood pressure and stuff. So with this, I feel there's like kind of similarity with a normal healthy lifestyle, which we should have any which way to maintain a balanced life. But my question to you is this, that you, in your conversation just a bit ago, you said people of our origin are more prone to stroke. Is there a reason why you said this? Is there more to do with something of our lifestyle that we lead, or is it just hereditary? Why did you say that people of our origin who have more potential of having a stroke? What made you say that?
Okay. The national statistics in Australia is from the studies, it is pointing towards people of Southeast Asian origin people with a darker complexion are having a higher risk of stroke. So because 80% of the strokes are due to our lifestyle and it's avoidable, being a person from Southeast Asian background, I mean, I know in our family and friends, we do, because we start our day late, we finish our business or our working hours quite late in the evening. And we generally have a very big meal after 9 p.m. or sometimes even 10 p.m. And imagine we have a big meal and most of us go to sleep with a full tummy. So these things could be a cause of, the unhealthy outcome. If we made as a general rule, in a lot of other societies, people do tend to eat a lot earlier. But in our community, we know we do like to party on fairly late, and we know we have a very big meal, about 10 p.m. So, and we go to sleep with a full tummy. That could be one of the causes.
Moving to my next question, which is, it's obviously there's a statistic that I, gone around on internet and found out that in India also there's like 1.5 million plus, cases per year of people having some kind of stroke, and and it leads to financial implications are just one side of it, which is like a long sustained thing that you have to carry on, and plus the the cut in the productive years that you can actually spend some time earning your living. And as this has been happening for people of the younger age as well, and plus the years lost could be having could have a devastating effect on the lifestyle of people around as well. But what do you think, is there a set timeline to this? Because as I said in the beginning, most of the times the confusion and anxiety around this, and also for the carers and people who are taking care of the patient, is the undefined timeline of this disease and the kind of financial implication it brings along with. So do you think, is there a, not really a defined, but like a tentative timeline in which people can recover?
Okay. If you are generally in a reasonable healthy condition and you suffer from stroke, your chances of recovery is much better. As long as we get to a medical facility within 4 to 5 hours, our chances of recovery is more than 1/3. Unfortunately, in Australia, 1/3 of people suffering from stroke end up with a lifetime of disability. And with the vastness of Australia, so many people living in remote communities, they are unable to access a adequate medical facility within a short time. And 1/3 of our people do pass away from stroke. And especially when we are of working age, 55 or approximately. Now we have dependents. If you are the sole breadwinner in the family, the rest of the family or the extended family is relying on you. So you can imagine, if you have just migrated to Australia, you got a mortgage, you got all these children and spouse to look after. So all the burden is is huge on the family.
Right.
Should something happen to the breadwinner.
But what do you think, just towards the end of this conversation now, what do you think we should be doing as a diaspora who are, in Australia? And and anywhere, if this my show goes to, you know, places like India, people watch it in US and other parts of the world, you know, where there are Indians and where there are people who are watching my show and following my social media. I want people to, you know, think about this. Just our before we end this conversation, what do you think is required as you know, part of this community to create that kind of awareness, and so that more and more people are, you know, clued in, they have the understanding of the stroke signs, and they can take care of the family also. Before we get to that, I want to ask you some of the challenges, that are faced after recovery as well. So for what I'm trying to say is, are there any limitations that a patient has to, you know, carry with him or her for all life? Like, you can't travel long distances, you can't travel you know, by car, you know, you can't have this, you can't do that, which they used to do before the stroke happened. So anything that you remember from your own experiences, that now your mother is limited by this illness that has happened to her, that she used to do some certain things before, now she can't do?
Okay. Just in my mother's case, fortunately, she is still managing all her own affairs. She can, you know, do all the domestic she used to do. She has actually traveled overseas as well because she does not have any physical limitation. You know, the breathing, the body movement, she doesn't have any pain.
Mhm.
And imagine if you do have stroke on one side of your body, say the left side, and sitting on an aeroplane going from Melbourne to Delhi would be, you know, approximately 8-10 hours.
It's like
So it
more
will
than
be
12 hours, actually, 12 hours
yeah,
plus.
yeah.
Yeah.
So it will be a very big toll on the body to
Mm.
travel that sort of distance in a confined seat
Right.
if you do suffer from stroke. I mean, we we haven't talked about uh, everything about stroke. How we know what are the signs of
Symptoms.
stroke?
Yeah.
Uh, because when you suffer from stroke, there there are three major things that happen physically in the body. One, a stroke sufferer, the face will droop on one side. So when they smile, one side will be bright, the other side will be quite dull, and it
Sure.
will be, you know, drooping. Uh, the the other symptom is maybe when they go to raise their arms, only one arm goes up and the other one stays limp. They're not able to raise both arms. Similarly, the leg, only one might move, the other one doesn't move. Uh, when they speak, their speech could be slurred and is very hard to understand. Generally because their tongue might be twisted and they're not able to get their words out clearly. And it's quite possible when you ask them a simple thing like what is their name, what day it is, they are unable to remember. So all these things are obvious signs of stroke.
Right.
There are other things that can happen and lead to a stroke, which are not very physically obvious. So this is you've got a headache today that is not going away by taking off-the-counter medication like Panadol and things. Normally, you get a headache, you take a Panadol, and you get better. But this one is hanging around for hours and hours and hours, and you just cannot get better. So this is very unusual for you. In the morning, if we wear glasses, when we put our glasses on, we can read clearly and see where we're going. But on this particular morning, you're not able to watch the news. You cannot read. So something has gone really wrong. So these few simple things are signs of something has gone wrong in your bodily function. The brain is not working properly. To please get yourself checked out. So,
So how do you differentiate? I mean, I understand. It's very fine thing, and sometimes people have chronic, headaches, and they don't realize that it might be a stroke sign. So I think only thing to do, and I've heard couple of instances also wherein people have, I'm part of this stroke communities survivors network in which they share their experiences, and sometimes because they are so generic in terms of headache and migraine and stuff, so it's like early signs of which you call as TIA or the minor stroke signs that comes. And if you go, and by the time you physically getting examined, you don't identify there's any stroke sign till the time you do an MRI or CT scan to see the brain function. So what is it? I mean, I do understand that, we need, but with the kind of lifestyle we're living right now, and it's not like, so what I'm trying to arrive at is that if you have headache, for example, not the other symbol, like, because you can see if your face is drooping, you can't move your hand. Obviously, these are obvious signs, but the minor signs of stroke, which is headache, as you said, and sometimes it goes away on its own, and then you don't realize you had a minor stroke, like a blockage of artery or something. How do you what do you do in this situation? Sometimes it doesn't get detected.
okay. So there are three types of stroke.
Yeah.
First of all, treat stroke as an emergency every single time. In Australia, we call 000. We get the ambulance and we get to the hospital as quickly as possible to get treated, especially if you are a stroke patient.
Right.
The 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 major cause of stroke is the blood that's flowing from the heart to the brain. The artery is blocked. This is in 80% of the stroke cases. So the brain is starved of oxygen. And this is the major cause of stroke. 20% of strokes is when that same artery has a leak. It burst open. So the blood is flooding into the brain. So this is a cause of a brain hemorrhage. So this is in about 20% of the cases for stroke. And the third one, which you touched upon, so this is called a TIA, a transient ischemic attack. So in these cases, quite often the symptoms will disappear in 5 to 10 minutes, and you start to feel quite normal. And you say, "No, something has happened, and I'm feeling good," and you generally ignore it. And in my mother's case, she had one of these TIA, and she ignored the symptoms and carried on with what she was doing. But please, this is a warning that we could have a major stroke in a few months' time.
Right.
And my mother did have a stroke in 3 months later, and fortunately, with good treatment, she has made a pretty good recovery. So always with your health, have regular health checkups, and if something does go wrong, and you see, get up one morning and you know something is wrong with me, please don't ignore it. Always have yourself checked out. And if you do suffer a stroke, do not delay it that I will go to the hospital tomorrow. Go and get it treated immediately, because unfortunately with stroke, the time is the number one critical factor.
So do you think that in case of stroke, if you recognize the early signs of stroke, the TIA, in which like you had a blurred vision suddenly and you tripped over, you've just fallen down, or you can't stand up, or these kind of things which are like blurred vision or stuff, and which gets all right after 5 minutes, do you think then the major stroke can be prevented if it is detected at that stage? Like in case of your mother, she had those symptoms, but she had stroke after 3 months. But do you think if it could have been prevented if you would have understood those signs and would have gotten her treated, with those signs? Is there a possibility?
Yes, yeah. According to the doctors, mother would definitely have avoided the major stroke she had 3 months later if she had gone and had herself checked out after the initial symptoms, which were very obvious to her alone 3 months earlier. So please, is always treat anything that has unusual for yourself. Your balance, your vision, anything that has gone wrong. Your headache is not going away. Go and get them checked out so they don't lead to a major stroke down the track. It could be something other than stroke, but it is something unusual for you. But do have them checked out.
This is something that we are talking about. If we identify those symptoms, we can prevent. But what if somebody is in that situation where you see someone having a stroke, are there any steps we can take in that time to minimize, just taking care of the person? Like in case of heart attack, we do certain things. So are there any steps that we can follow in a situation wherein we see someone having a stroke before the ambulance arrives or you take them to facility? Are there any steps that a person can follow who's seeing someone having a stroke?
Yeah, the very simple things you can do is you give them assurance that you are there. Keep the head a little bit elevated from the body, and have them lying down at slightly at an angle, so it's easier for them to breathe. If they have any tight clothing, do loosen them a little bit. Do make sure that the breathing is normal. If there's no pulse and they're not breathing, start providing life support and continue until the ambulance and the paramedics arrive.
And what couple of things that you, from your experience or by the time that you're volunteering and understanding and meeting people of different level of severity of people having strokes, what are the 2 things that we shouldn't be doing? Anything that you remember?
Unfortunately, in Australia, because of the remoteness of the country, people do tend to drive to the doctors when their health is poor. They don't have access to an ambulance, or maybe there's nobody around to help them. If you are in a situation where there's somebody with you, and the ambulance is readily available, please call the ambulance. Let them take you to the right medical facility, because they will recognize the signs of stroke because of their training. And not all hospitals are geared up to provide stroke support, so they will take you to the right hospital.
Right.
Unfortunately, if you don't have access to an ambulance and somebody can drive you to a medical facility, that will be the second option. Please don't drive yourself to the hospital, because you are likely in your confused state to make a mistake and end up with an accident.
Any giveaways from your own experience that you would like to share? And I understand that a person who's living through the stroke and recovering is suffering the most, but people around that person also are having a vicarious kind of a trauma around managing that person, because the inability to cure or have a timeline of when the person will be all right, that gives the other person or the relative or the carer also that kind of anxiety. When will this be all right? How long will it take? And managing the day-to-day chores of the patient also, even though there's you can have access to attendant or nurse 24/7, but unfortunately it's a financial implication also for people, to have it like an, ongoing basis forever. So some people, what they do is that initially they might be able to do it, and then they have to start doing it on their own. Even if there are attendants, you still have to manage with the person's mood swings and anxious attacks and those kind of depressive state of mind wherein they will don't cooperate with the attendant and they need support. So what are your suggestions for people who are carers to manage and yet maintain their own balance, physically and emotionally and psychologically, so that they can travel this distance with the patient towards the recovery, to the very end, wherein the person is again, if not 100%, 80%, 90% all right. What are your, own?
When somebody in the family does have a stroke, obviously that individual will go through a depression and their anxiety will increase. Depending on how severe the stroke is how much they will be affected. And as family members, of course, we try to take care, and then we have the responsibility to our own jobs and our own liabilities. But the person who is suffering is the person that will be the one who will suffer the most if we don't provide them the right support. So there is, on the stroke awareness website, there is a lot more information how we can help our loved ones by going on the internet on Stroke Foundation Australia. The other good website is enableme.org, has a lot more information. And there are phone numbers we can call and talk to an expert at the other end of the phone who can guide us if you're caring for a loved one who is suffering from stroke, or you just want to find more information. It's available. But you can imagine if you are a healthy person today and you have suffered a stroke and you're not able to do what you have just done yesterday, like driving or going shopping and traveling. So the depression will set in, and it is very important for us to keep providing the care and also look for the government help and the community nurses who come home to take care and provide the support service.
Right. So what I get from this conversation, Nash, is that even though the person who is suffering the most is the person who has had the stroke, there are people who are have caring duties in their own life, around which they have to still go on their daily jobs, manage their kids, households, and along with the patient as well. It's very important to understand that you also, as a carer, do need to maintain your own healthy lifestyle and don't get pulled up in that cycle, just leave everything and just focus on one thing. Because if you, as a carer, are not fit enough and you're not taking care of yourself, it becomes even more difficult, to manage the entire situation. And obviously there are, depressive states, and, obviously it is quite understandable that people who were doing something just a day ago are unable to do it the next day. It's obviously understandable, what kind of state they are in. So understanding all that and just trying to, maintain your own healthy mental balance and try to do whatever best possible you can, but don't stress too much as well, is what I am getting out of this. And there are help options available, like the website Stroke Foundation has a lot of resources, and there's a helpline that you talked about. There's a website that you just mentioned, where you can get some tips and tricks from people who have had stroke. There are carers who have shared their experiences that may be able to help the loved ones, you are taking care of. So So before we end, I just want to recap the entire thing so that we understand, have we missed anything. If we want to just talk about before we end this interview, is the first thing is to understand the signs of stroke, which are
the face, the arms drooping, speech is slurred. So these are the three major signs.
right.
And the other health issues, it could be you're having an unusual headache, your vision is blurred, you've lost your balance, unexplained episodes. So
Yeah.
anything unusual with your health.
Right. So anything unusual and these signs that he's talked about, just take care of those signs. And if you have those initial stroke signs, very, very important is to immediately, go and get a medical assessment done and see if there are stroke signs. If not, get a clarity around it. But there are ways we can prevent stroke, and there are these things that you can do in your daily life. So it might sound cliche, but these are effective things. So what are these things that we can do to prevent stroke in our day-to-day lives?
Okay. Number one is stay on top of your health, have your regular health checkups, keep your existing medical conditions under control, and take regular medication. Eat healthy, avoid as much salt and sugars as possible. Have some regular exercise. Enjoy free time with family and relax and reduce the stress in your lifestyle. And do look up the internet and talk to people in the stroke field. They can provide you with bit more information. And on the internet, which is enableme.org, has got lots of information. You can read how to care for somebody who's suffering from a stroke, and just general knowledge as for yourself.
Unfortunately, we cannot control, these things which happen to us, but we can definitely take precautions to minimize those risks. And these are certain things that we discussed today on our show with Stroke Foundation's help, and Nash, who has graciously shared, his experiences, and he is doing volunteering with Stroke Foundation and telling us about what are the things that we should be doing and not doing in case of stroke happens. It's upon us to manage our lifestyle, manage our day-to-day thing. There are a lot of problems, there are a lot of stresses, there are a lot of anxieties around the kind of environment we are living with, COVID times, and day-to-day life uncertainties around. But there are definitely things, as I said, life is precious. Enjoy the day, enjoy the night, enjoy your family, friends, enjoy every moment. But also, in your enjoyment, just take care of things that we need to do. Don't do anything in extremes. Do everything in moderation. And with that, I hope that this episode of ACD Desi has helped you in certain sense and able to get some kind of awareness around the stroke. And we will keep doing these kind of sessions with Stroke Foundation in future as well. So I thank Stroke Foundation and Avinash Swami, especially coming on this show. We are recording this during the stroke week, which is 8th to 14th of August. This is a pre-recorded one, so this might come in next week and week onwards. But this kind of information is relevant 24/7, all 365 days of the year. So with that, I'll take your leave, and thank you so much, Nash, once again, for spending time with us and sharing those important details. Any last words?
Because thank you for AC Radio for inviting Stroke Foundation. We are very fortunate to be able to speak to the listeners to spread the word in the community. The more people that are aware of stroke symptoms, hopefully we reduce the incidence of stroke in our community and our loved ones are taken care of. Thank you very much.
Thank you very much. और आप सब लोग जो सुन रहे हैं और देख रहे हैं, अपने देसी ACD देसी अंदाज में मैं इस शो को एंड करना चाहूंगा. तो जब तक हम मिलते हैं दोबारा, अपना ख्याल रखिएगा। स्ट्रोक फाउंडेशन की वेबसाइट पर जरूर जाइएगा, इंफॉर्मेशन लीजिएगा स्ट्रोक के बारे में। इट्स अ साइलेंट किलर, बट वी हैव टू नो मोर अबाउट इट टू फाइट अगेंस्ट इट। सो अगेन, जब तक हम मिलते हैं दोबारा, अपना ख्याल रखिएगा। शुभ रात्रि, शब्बा खैर, गुड नाइट, and good morning wherever you are watching this from. Thank you so much.
Thank you very much.